Coming up next on The Voice of Alabama Politics, our special guest, U.S. Senator Doug Jones. Also, the V Team takes a look at scared, restless, and bored. And Kay Ivey stands her ground on reopening. Yeah, she is that fierce. All this and much, much more coming up next on The V. Welcome to The Voice of Alabama Politics, where we tackle the tough issues so you have the hard facts. I'm your host, Bill Britt, and today I'm joined by Josh Moon, investigative reporter and columnist at APR, and Susan Britt, my wife and partner, here outside of beautiful downtown Attala. How are you doing, Susan?
I'm doing great. How are you doing, Bill? Josh?
Doing great. How are you, Josh?
Oh, fantastic. How about yourselves?
Well, locked down and might as well be locked up, right?
Well, I don't know. Having been to an Alabama prison before, I'm pretty sure we're better off.
Much better off. Well, Susan, this past week we saw a spike in the COVID-19 cases in Alabama. It's something that was expected. You know, we had a high of about 283 cases reported on Wednesday. Mm-hmm. So we're not seeing the numbers go down yet, but we understand that this is a spike period. So far, nearly 6,000 total cases, 700 plus hospitalized, and over 200 dead.
Yeah, we're not beginning. I don't know exactly how the social distancing is helping at this point in Alabama. It looks like, we were declining in the diagnosed cases per day for a while, but now it seems like they're spiking back up again. I'm not sure what the indication.
Well, I think Dr. Harris said that we should look for a spike around the 22nd. Mm-hmm. So that would have been when it happened. Now, if we see it go down over the next week, that'll be a positive sign. Josh, but you've looked at some of these numbers. We're just not doing enough testing. I mean, we're at about 1%. We've tested around 56,000 Alabamians. That's around 1%. But you've looked at other states to see the trending in testing there.
Yeah, and if you, if you look at the states around, or the counties in the states bordering Alabama, and look at their individual testing and kind of go and compare it to the counties in Alabama just across that border, you see a pretty big disparity, especially in Georgia and Tennessee. And you can see where, let's say like Claiborne County, which I wrote about earlier this week, where they've only tested 50 people in all of Claiborne County in Alabama. And then right across the line, you have one of the biggest hotspots in the country in Georgia. And, the idea that the virus is respecting the invisible state line is kind of, ridiculous. And, and I understand that there's some factors that lie in some of those counties there. They'll have some plants, or they'll have a bigger city where people are more densely populated. But the fact remains, we're not doing enough testing. And so I don't know, at this point, there's no way that the state of Alabama can rely on testing numbers going down as an indicator, or positive tests going down as an indicator of us getting better. What I think we're going to have to look at is hospitalization rates, and things of that nature. Because we got 10 counties or so where we're not even testing anybody at this point. It's just
right.
We can't do that.
And of the 67 counties, only 30 of them, or somewhere about 30 of them, have tested at the 1%. The rest of them are below testing at 1%.
Yeah. They can't make the 1%.
Some, I can't remember which county it is.
Well, Geneva County is at like 0.4%, 0.4. Wilcox County, where Governor Ivey's from, is not much better. I mean, so it definitely doesn't, it crosses borders and it crosses parties. So it is certainly bad. We would have to triple the number of tests that we're doing right now to even get near where we need to be. And people are clamoring for us to open back up the economy. I mean, I get it. People are scared, tired, restless, and bored. You throw into that mix that they're angry and resentful. And Josh, I mean, we're seeing some of the best behavior in people, and then we're seeing some absolute lunacy.
Yeah, there's some real lunacy taking place, and some people who are very cavalier with other people's lives, at this point. And I understand that there is some unfairness taking place there that I think could be corrected with an easing of an order slightly here. Maybe letting some retail places open back up, but because you've opened up big box places and put the same restrictions on everybody and let some of these places open back up. But at the same time, we have, I think, been able to make a dent in what's taking place with the spread of the virus. So, if that's the case, then, I think you've got to wait until you see those hospital numbers drop down to where the people at the hospitals feel comfortable that they're not going to be overrun and they're not going to have these major issues if another flare-up occurs.
Right, and there are some people that, Susan, for right or wrong, believe that the government telling them where they can go and when they can go there and all that is a form of tyranny. Mo Brooks has come out and basically said, well, we don't want the government dictating to us. And my thing is, Mo's side of the aisle will dictate everything in your life if they get a chance. The Mo Brookses of the world. So this is not about the governor dictating. This is about the governor doing what she's supposed to do, which is to keep people safe.
This is the governor keeping people from doing things that are stupid too.
Yeah.
Some people don't even believe that the COVID-19 exists, and so they would be likely to infect someone who maybe does believe it exists.
Right.
So I mean, this is. Sometimes the government just has to say, put their foot down like your mama and say, look, y'all need to stay home.
Yeah, and that's kind of where we are. I mean, though, Josh, I don't know if you saw any footage of the protest outside the Capitol in Montgomery. There were a lot of folks driving around in cars, honking their horns. There were a few people out there. One guy had a poster said, "I need a haircut," and I agree, he did. But from the looks of it, the haircut ain't going to help him that much.
I got a suggestion for him. I don't think, to me, those things are even, those protests at this point are really even worth mentioning all that much. Because at most all of them, including the one here in this state, the people covering the protest and the looky-loos going out to watch the people at the protest outnumbered the people protesting. So, you've got a small number. These protests are hugely unpopular among even Republicans out there. And, I just, to me, I don't know what you're trying to accomplish here. You're taking people, and I understand everybody's scared, all right? And I understand it's a weird situation, but we're all in this situation, okay? And I don't know what other alternative you think is better than this. People will die if they do what you're suggesting they do.
All right, well, we're going to have to leave it right there. People protesting social distancing by social distancing in their cars.
In their cars.
All right, you're watching The V, the voice of Alabama politics. Up next, U.S. Senator Doug Jones speaks his mind on The V.
What a great opportunity for your success. Adding 500,000 highly skilled employees to our workforce by 2025 is how we stay ahead in Alabama. Our economy is stronger than it's been in years, and a skilled workforce is more important than ever. Things move fast, so choose your path. Your success is waiting, plus a great future for Alabama. Success Plus. Go for it.
What are you doing today, babe?
I thought I'd head down to the lake with the guys, do a little fishing. Of course, none of us will be wearing our seatbelts. I'll lose control of the truck, wrap it around a tree, and kill us all.
Okay.
Drive safe, Alabama. A message from your Alabama Department of Transportation.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65 or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Welcome back to the voice of Alabama politics. We're joined today by U.S. Senator Doug Jones. He's joining us from Birmingham. Senator Jones, thank you for being on the voice of Alabama politics today.
My pleasure, Bill. Hello to you and Susan. I hope you're doing well.
We are. Welcome to our home, too, outside of Atala, Alabama.
Very good.
I know the Senate has been working very, very hard, and you've been working extremely hard on the behalf of the people of Alabama. And one of the things that I've noticed that you are really concentrating on right now is how do we convince the state to expand Medicaid during this time of crisis? Can you help us understand how that would help the state, our hospitals, and our citizens?
Sure. Thanks for asking that, Bill, because let me tell you, I think that this crisis has really shone a spotlight on the need to expand Medicaid in Alabama. We've got 325 to 377,000 Alabamians who would receive good health insurance benefits if we could expand Medicaid, and it would bring billions of dollars in to this state. The fact of the matter is, right now, most of the health care dollars for the uninsured like that is going to come from the federal government, but it's going to come through giving money just to hospitals to help prop them up. If we expanded Medicaid right now, we would bring in billions of dollars, but also, and this is incredibly important, give good health care to a lot of the needy Alabamians that need it badly. And these are people that have been working in the past. So I think if we do that, we can make sure that we continue on the path of, everybody knows that my health is dependent on yours and yours is dependent on mine. And this would be a huge win. What I'm hoping to do in the Congress is to convince the Congress in the next package to put some incentives so that we can give states like Alabama incentives, maybe 100% match, so that there really be no excuse if we could do that for Alabama not expanding Medicaid. But we need to get that health care, folks, to folks across the state.
In a supermajority Republican Alabama legislature, how do you really think you're going to convince these guys down here to go ahead and expand Medicaid when they've been so resistant, even though there have been incentives before?
Well, I think that there has been two things. Number one has been an economic reason, and that probably exists today more than it did 6 months ago to do that. But I think if we give the 100% reimbursement for a period of time, it would sure help with that. It would make that a non-issue. The other thing, quite frankly, guys, it's just been purely political. I mean, this is part of the Affordable Care Act. It's been purely political. There's a knee-jerk reaction to it. But I'm going to tell you, I've seen the polling done by us, by others. This is supported by a huge majority of the people of Alabama. So I think these legislators ought to do some serious polling in their own districts. But what you're going to find is that the people in Alabama support it, especially now. They know that getting their neighbors good health care is going to help them and their communities and overall the economy of this state.
And that is a grave concern. I've heard you say that time and again. We, at this time of crisis, neighbor helping neighbor and neighbor depending on neighbor. And that's not just our next door neighbor. That's all Alabamians. We all are in this together. And it seems reasonable what you're saying.
Well,
it's just, can we get reasonable people to come together, right?
There's no question, Bill, and it's going to have the secondary benefit down the road of saving rural hospitals. It's not the silver bullet for those, but it's going to save rural hospitals. It's going to bring that money into those rural areas that can help their economies. It's going to create jobs. I mean, it would be close to $1 billion a year that we would get coming in here. So it's just, it's one of those things, and Alabama has left a lot of money on the table, and it's time that we get our fair share.
Well, I agree with you. There is something that you're working on in the Senate with your colleagues up there, and that is the Paycheck Security Act? Is that what it's called? Could you explain for our viewers what that is and what that will do for the folks of Alabama and our country if it gets passed?
Sure. It is a supplement to the payroll protection plan. You know, everything that we've done, guys, is a work in progress. As we see the depth of this pandemic and the crisis and how we're going to have to slowly open the economy back up, you can't flip a switch. This is going to last for some time. There are going to be people that are not working in any unemployment lines for a period of time. The payroll protection plan is a good way to do it, but I don't think it has been the most efficient way to do things. So we had to put more money in. It's likely to run out within a week or so after it gets funded. So this plan will create a program where business can use payroll processing companies, go straight to the Treasury or the IRS to fund their payroll for people up to $90,000 per paycheck. It's a plan that you've got to show a loss. It's a plan that you can't have a lot of cash reserves. There's a lot of protections for it. But if we do that, it would give these businesses and these employees a way to safely open their business, not just emotionally think that they've got to get out there and run that business right now, but they can do it safely, healthy, and they can do it in a way that continues to keep the business afloat and keep the employees, because that's really the bread and butter of any small business, are the employees that are working there. It keeps them afloat as well. It's a great program.
Well, and with, back of the envelope, my math, we're looking at 15 to 20% unemployment, records going back to 1987. That would be the worst we've seen because we didn't keep records before that. But it's going to take a huge hit. And while some folks are resistant, it seems to me that right now we're going to have to rely on leaders in government to help us get through this crisis.
Well, Bill, that's exactly right. I think a crisis like this is the time when leadership has to step up and make some really tough decisions. I think the governor did one the other day that I commended her for. She resisted a lot of political pressure from our neighboring states. But leading in a time of crisis, I think, is important. And unfortunately, we're having to spend a lot of money, a lot more money than we ever dreamed that we would have to spend. But it's incredible. We really don't have a whole lot of choice because we want to keep these businesses open for business when we do get rolling again. And we want to get those employees their benefits, keep them on the payroll so that at some point we can get back to some sense of normalcy. But you got to do it gradually. And the Paycheck Security Act will do just that.
We got about 40 seconds. One other thing I wanted to ask you about is you've written the governor and you've written to the governor about a healthcare manufacturing task force. Can you give us quickly what that means?
Sure. There's no question, Bill, that we are too dependent on foreign countries for our healthcare equipment, whether it's masks and gowns or ventilators. Alabama is primed with all the medical research and great healthcare facilities that we have from one end of the state to the other. We are primed to attract manufacturing, healthcare manufacturing, have those jobs in the United States so we can reduce the foreign dependence on that. And folks like the governor of Maryland don't have to go to South Korea to buy 500,000 masks. We can do those all right here in Alabama. I think we've got the infrastructure to do that. Just look at what happened yesterday with the closing of the Goodyear plant up in Gadsden. There's a lot of things that we've got here to work for us. And I think they're already looking at issues like this, and I applaud them to do it. I want to help as much as we can. I think Alabama's got an opportunity here.
Well, Senator Jones, we appreciate all your efforts on behalf of every Alabamian in Washington, D.C. Please stay safe and come back and see us soon.
I'll do it, Bill. Thank you. You and Susan, take care.
Thank you. Our special guest today was U.S. Senator Doug Jones. We'll be right back with more news and opinion.
Hey man, what are you doing today?
Playing the game. Thought I'd go out for a drive later maybe. Text some friends while I'm doing it. Scroll through social media. Kill a family 4 and a head on collision.
Cool, man.
Drive safe, Alabama. A message from your Alabama Department of Transportation.
A lot can change in 5 years. Except those smile lines you treated with Bellafill. Because that's about how long Bellafill will keep them smooth and filled. 5 years. Now you can always look your best without all those injections, appointments, and costs. Bellafill is the only dermal filler that stimulates and maintains collagen growth long term. Now time is on your side.
Welcome back to the voice of Alabama politics. You know, Josh and Susan, there's a reason to reopen. You know, over the last 6 weeks, unemployment is somewhere between 15-20%. Over 360,000 Alabamians have filed for unemployment. We are headed for some type of recession, or in the middle of it, or possibly even a depression. The state is considering that it has lost at least $1 billion in revenue. But Josh, you know, are we at a place where when we open the economy, do we think it's going to come back with some quickness, or is this going to be long drawn out?
Well, I think that because I think everybody is scared here. So I think a lot of people are coming to these kind of decisions about trying to rush to reopen it. And listen, everybody is a little nervous about what's happening. But reading the stuff from actual economists and people that know this and study things on a daily basis, it's their lives. They expect kind of a U-shaped recession, depression type thing for the economy, where we're going to kind of fall off a cliff, which is what we're doing. But once we kind of get to the bottom and we start to reopen things back up, we're going to come up pretty quickly because we did have a fairly good economy coming into this thing.
Yeah.
I think people could argue whether or not the economy was necessarily great in Alabama with the low wage jobs and some of that nature, which has really impacted us more so here.
Wow.
But I think that once you do start to come back, a lot of those people are going to go immediately back to work. All right, you're going to have a lot of immediate jobs come back available, and so you're going to have a real cut to that unemployment that wouldn't ordinarily be there in a regular recession, depression type situation.
Right. Well, Susan, Governor Kay Ivey has resisted the call to reopen the government, reopen businesses before April 30th. I was very proud of her. I think we all were, for taking that stand. She gave him kind of a Clint Eastwood stare and said, no, I'm going to listen to the medical professionals. And her COVID-19 task force is primarily made up of medical professionals. So while she's getting a lot of political heat, I think she's going to make recommendations that we hope are reasonable, and I tend to believe they will be. I mean, May 1st is right around the corner.
It is.
And there are a lot of people wanting to open things up. Is there any way to open things up reasonably?
I think what we're going to see, recommendations coming out of the governor's office this week, is going to look more like maybe opening retail first, because that's something, the argument is that if you can buy shoes at Walmart with 500 people, why can't you buy shoes at your local shoe store with 5 people in there? The challenge for that, I think, is going to be these businesses being able to afford the PPEs that will be necessary for their employees to be able to get into the store and serve people. But I don't think it's going to be the big recommendation that Will Ainsworth came with last week. I think it's going to be more of a peppered sort of approach.
Well, I mean, it makes sense to me to do something that's more incremental, Josh. I can see, like Susan said, opening up some retail venues. I mean, if I can buy running shoes at Walmart, I can certainly buy them at Foot Locker, right? Makes no difference where I buy my running shoes. I can see a scenario where, we go back to some elective medical procedures as well. One of the big questions, at least on my mind, you were talking about PPEs, is how do you open a dentist office? Is that something we can do?
Yeah, I don't know. And I think, as far as elective surgeries and things like that go, I think that you leave that up to the hospitals, and if that's the recommendations they have, because they kind of self-police themselves going into this and cut a lot of those things out. And so I think if they're saying, listen, we're comfortable with the capacity that we have, that we can safely do these things, then I think you follow their advice. Because again, if we're not going to listen to the doctors and people there that are making those decisions, then I don't know who else to listen to. And if they screw it up, they screw it up,
Right.
and they'll have to face the consequences of that. I do worry about opening up a lot of things at once, just because I think you're going to force back some people into jobs where it's going to put them at risk, for people with some underlying conditions and some fears of that nature. And I just worry what sort of situation you're going to put people in, and then what sort of liability you're going to put the state or those stores in terms of people possibly dying because they feel like they're choosing between paying their bills and death.
I couldn't believe that they put out this thing this week that said basically, well, if your employer calls you back, you got to go or you don't get unemployment. You know, well, what if they have, diabetes and heart conditions and asthma and all that? I mean, come on, you're asking people to put their life on the line to go do a job.
Yeah, there was a caveat in there, is that you could be, without your unemployment compensation if you fail to go back to work, but which implies that there's going to be a process in there. But they didn't mention the process. They didn't say, well, if you have an underlying condition, don't worry about it. Don't. And so, but because it's typical kind of Alabama politics at this point, and we're expecting the worst out of people instead of expecting this group of people, this group of Alabama workers who were 97 to 98%, employed when this all happened, who were going to jobs every day, who were working and who were chugging the economy along. Instead of expecting the best out of them, that they'll go back to work if they can and if they feel safe, you're expecting the absolute worst out of them. And I think that's a pretty big flaw at this point.
I do too. I think opening up barbers, hair salons, nail salons, tattooing parlors, massage parlors.
It's way too early.
I mean, that just seems illogical
way
to
too
me.
early.
I don't see how you do that safely. But the legislature is coming back on May 4th. We got about 40 seconds. I don't know how that's going to work. But
May the 4th
they
be
say
with
they want to come in and pass some local bills and the two budgets.
Yeah, they're constitutionally required to pass those two budgets, no matter what they do. They're supposedly going to take it. I think it's the first floor, the big room. I think they're going to use something like that. My concern is they're saying that they're not going to allow the press in.
Well, I think that was an indication, but I think that's been smacked down now. They cannot constitutionally keep the press out of it says in the Constitution we are allowed to witness, to be there on the floor. It says that specifically. All right, we're gonna have to leave it right there. You've been watching the voice of Alabama politics. You watch us because we watch them.